Hello, good morning. My name is Christy D. For those who do not know me, I worked in a dental lab for over 7 years, and I am passionate to share with you my experience in the dental lab and also give you some tips to help you with your case production and to prevent delays. Any questions, most common questions that are asked are answered here. I hope these videos are helpful. Again, my name is Christy D, and stay tuned. Alright, in this video we will be covering as far as what appliances can be repaired, and if so, what type of impressions we will need. Alright, let's get started. So I'm going to go ahead and display a couple images, and I'm sure if you're in a dentist office, you're more familiar with these images than anyone else. So there's times that we are called at the dental lab and we're asked, hey, could you review these images and let us know if this is repairable? How many days will we need it out of the lab, and what type of impressions? So we're going to cover first some images, of what we have, and then we'll go ahead and discuss as far as what type of impressions and turnaround. That is what we consider a clean break. Anything that is a clean break, we can repair. Normally we need the regular turnaround of 1 to 2 working days in the lab, plus a day we pick it up and deliver. Remember, I mentioned in the previous videos as far as the courier service, they pick up the night before, deliver the day of your delivery date, so it's an overnight procedure, okay? So the clean break we can repair in 1 working day to 2 working days, and it can also be the same as it's scheduled with time in advance. There we go. So this is an image of a broken lower denture. I'm going to show you an image of an upper denture, and this image is actually pretty common. This tends to happen a lot with the upper dentures, most of the time than the lower dentures. And in my next video, I will explain why that happens very frequent and how to prevent it. But let's focus on repairs. So this is another image of of a denture that is broken in half, and it is what we consider a clean break as well. We can repair it in 1 or 2 days. And I'll show you just one other image, or actually 2 more images based on the repairs. When a tooth pops out of a denture or a partial, it is also considered a clean break. We can easily repair that with no extra time needed or delays. And this is an acrylic partial that broke in half. So as you know, we can repair these appliances. The purpose of me pulling up this one is because when it comes to a denture that it's broken in half like the previous images, those are easy repairs, and for full arch dentures we do not need any type of impressions. We can easily repair. We can also fix partials, but when a partial breaks in half, what actually happens in this moment, for any appliance, we must have a pickup impression with partial in place in order for us to repair any existing partial. And when it tends to break in half, all you have to do at a dental office is glue that part, place it in the patient's mouth, or have the patient put the partial back in place, and prepare a tray for an impression. Press up and hold, of course, until time for the impression material to settle. When you remove that partial will stick to the tray, and that you don't need to pour up in the office unless it's an alginate impression material. But if it's the rubber-based material, there's no need for you to pour it up. Leave it as is. Do not remove the partial from the tray. Leave it in the tray. We in the lab will take care of it for you. There is times when we get cases to repair and they do the exact procedure we need, but they remove the partial from the tray and then make the mistake of pouring it up. When you do that, that whole procedure was useless. So there's a purpose why we need the partial in the tray, and that is in order for when the technician pours this up and he breaks it up, he'll be able to get an exact visual how it sits in the patient's mouth, so that adjustments are done exactly to how it was when the partial was previously made. So this is why I pulled this up, because dentures that are broken in half can be easily repaired with no impressions, okay? But partials that are broken in half must be on a pickup impression with the partial in place. And also, I think I have yes I do, great. I have an image of what a pickup impression looks, but this one's for a cast partial, but again, it doesn't matter. As long as it's for a partial, this is the type of impression we need in order for us to be able to repair it properly. So that is the procedure. You sent that to us, and then we take care of the rest. There is a time that a broken denture comes to where we are unable to repair it. Unfortunately, in that case is when we ask the dentist to mention or consult with the patient considering having a new denture made. We don't like to do this. We like to help out based on what's prescribed on the lab script. But there is just times that unfortunately we can't move forward with what we receive. Either the denture's way too old, it's broken so many times, the patient never assisted to a dental office and decided to repair it by himself or herself. And all that glue is to it to where we don't have an exact fit of where the first broken line was at initially in order for us to be able to puzzle it back up together and have it repaired. So that is when we call the office and explain to them that unfortunately we are unable to repair that denture. That just cannot understand the situation of or the procedure of a dental lab. So in that case, if that happens, we get in the shoes and the position of the patient and we say, hey, let's repair it for them. But again, I want to say it's a 50-50 chance we take that the patient's denture will fit back in place, because we just guess a line. We have to remove all that glue, and they really don't have a guide, so we have to add acrylic here and there to make it fit. But again, like I said, it's a 50-50 chance. We're not sure if it will work out or not. Most of the time they come back with new impressions, and they send it back for adjustments here and there, so patient can wear temporarily, but it most of the time it snaps back again, or it's just loose, or it's not fitting on the soft tissue area, because we're pretty much guessing this part right here. There's pieces of that denture missing, and when that happens is when we strongly suggest to consider having a new denture remade. Okay, so that's why I wanted to talk about in repairs. Those are the basic questions asked. Is this repairable? If you see images like the ones I showed you of a denture where there's a clean break or of a partial, yes, they are repairable. Do we need impressions, and what type of impressions? For dentures, we do not need any type of impression. For partial replacements or partials, we must have a pickup impression with the partial in place always, so that we are able to successfully repair that partial for your patient. And then I also covered what we consider non-repairable, and if it is repaired, again, we do not guarantee it will work out properly for your patient. In the next video that I'll be bringing up, I will show you some images and cover what a reline is, the turnaround, what type of impression we need for a reline, and what may cause a break like the ones we just saw in this video. So please stay tuned. Don't forget to subscribe. Give me a thumbs up if you like this video. Again, I appreciate your time. Thank you so much. And I send you a big hug and kisses. Bye.